Hello and welcome back to your Therapy Guide, a podcast created to help you navigate your therapy journey. I'm Dr. Yadegarfard. In this episode, I'll provide you with a detailed map of the therapy journey so you know exactly what to expect. We'll explore the three main stages: assessment, formulation, and intervention. Stage 1. Assessment. The first stage is all about understanding your current situation. Think of this as the investigative phase. And for this, I often use the analogy of an iceberg. When you look at an iceberg, you only see the tip, the small part that's visible above the water. This is like the immediate current problems and symptoms that bring you to therapy. It's the anxiety, the sadness, the anger, or the conflict that you're aware of and that are causing you distress. During the first few sessions, we'll focus on this tip of the iceberg, which is your current presentation. However, the real power of therapy comes when we look at the much larger part of the iceberg that is hidden under the water. This is where your past experiences, your childhood, any past traumas, or your deeply held beliefs reside. These are the underlying factors that are often contributing to the problems you're experiencing today. Here is a crucial point about diving deep. We can't just jump in. It's like a deep sea diver. Before a diver can go deep, their body needs to be strong and stable enough to handle the immense pressure. In therapy, this means we first need to ensure you have a solid foundation. If your day-to-day life is extremely difficult, or if you're not eating or sleeping well, or if you're under constant overwhelming stress, it would be extremely difficult for us to dive into the deeper, more painful material. Your body and mind wouldn't be able to tolerate the extra pressure. So we might focus on the tip of the iceberg first, building your stability, coping skills, and routines before we gently and carefully explore what's underneath the surface. Stage 2, formulation. Once we have enough information for the assessment, we move on to the second stage. Formulation. Formulation is a working hypothesis we create together to explain your difficulties. It's not a diagnosis or a label, it's a shared understanding of how and why your problems developed and what keeps them going. Think of it as a logical story or a timeline. It connects the dots between your past, the underlying factors beneath the water, and your current difficulties. A good formulation will help us understand why certain thoughts, feelings, and behaviors are happening for you specifically. It's a way of saying, based on what we know, this is our best guess about what's going on, and here's what we can do about it. A formulation is important because it shifts the focus from what's wrong with me to what makes sense about my current struggles. It empowers us to create a clear and effective treatment plan. Stage 3. Intervention. The final stage is intervention. This is the stage where we put our plan into action. Based on our formulation, we will introduce specific tools, techniques, and skills. This might be practical tools from a model like CBT, or they might be new ways of thinking and relating to others. However, the therapy room is not where the magic happens alone. We need to test whether these tools and techniques are suitable for you. So after each session, you will be invited to go out and practice these new skills in your daily life. This is the crucial part of our collaborative work. You'll come back to our next session and tell me what worked and what didn't. This back and forth feedback loop is essential. It allows us to review our progress, refine our tools, and ensure we are always heading in the right direction. We will continuously review our work to make sure our approach is working for you. So the therapy journey is not a linear one-way street. It's a collaborative process of understanding, planning, and taking action with a continuous feedback loop to ensure we are on the right path for you. Thank you for joining me on this episode of Your Therapy Guide. These short episodes are designed to answer some of the most common questions my client ask, and I encourage you to listen to other episodes to find answers to your questions. Don't forget to subscribe to this podcast and follow me on my social media channels so you don't miss any future episodes. You can find all the links in the show notes. Until next time, take care.